Dr. Mendel again, going over this model, which we call the flat man model. Let's start with the arteries. We see the heart, and so we see the aortic arch coming off of that. There's three branches coming off of it. The first being this red one underneath, which is the brachiocephalic. We have the left common carotid, and then the left subclavian, the three branches coming off. If you look at the brachiocephalic, the first branch coming off of that is going to be the subclavian artery. The subclavian artery changes names. It's not a different branch, it's the same vessel, just changes names when it gets around the armpit. So right around the armpit, it's now called the axillary artery. After the axillary artery, it continues down and goes around the bicep area, where it now changes names to the brachial artery. So the brachial artery is here in the arm. It goes to the elbow, splits into two vessels, that one is going along the ulnar bone, called the ulnar artery. One's going along the radial side, which is a radial artery. We have the deep palmar arch here, and the digital arteries going down into the fingers. If we go up to where we were, we also see the common carotid going up into the neck, which will split into the internal and external carotids. The aorta dives down, goes through the diaphragm, and comes out, which is the abdominal aorta. Here we see a better view of the celiac trunk. There's three main branches, although here they show a fourth. The first main branch goes to the stomach. It comes up here, it's called the left gastric artery. The second one is going to the spleen, and we see that as the splenic artery. And then we see one going to the liver, which is the hepatic artery. We see some in blue here. Those are the hepatic veins. The one in purple drains the digestive tract and sends nutrition to the liver, which is the common hepatic vein. That's wrong. Hepatic portal vein, hepatic portal vein. So we have the hepatic artery, hepatic vein in blue, and the hepatic portal vein in purple. We now see the second branch coming off, which is the superior mesenteric artery, the renal artery and vein, the gonadal artery, the inferior mesenteric. We split the abdominal artery into the left and right common iliac artery. There's a branch called the internal iliac, the external iliac. This vessel here in blue is the inferior vena cava. So it's a different name than the abdominal aorta. However, the rest of the vessels, as far as veins, are almost the same name. I'll mention a few that are different. So here, for example, this would be the common iliac vein, the internal iliac vein, the external iliac vein, just like the arteries. After that external iliac artery crosses around the pelvis, it goes by the femur, now called femoral artery. It goes down behind the knee, called popliteal artery. There's a branch under the knee that goes anterior to the tibia, comes out as the anterior tibialis. There's a place right here you could check pulses called the dorsalis pedis. The second branch is the posterior tibial artery, goes down to the foot, and we have brachial artery, digital arteries around the toes. The two things in the leg that are different, vein-wise and arteries. This one goes from up near your iliac vein, but there's a branch. Instead of the femoral vein, there's a second branch, comes down, and we see this vein goes all the way medially, goes past the knee all the way to the big toe, or at least the arch. This is called the great saphenous vein, and it's the entire length of the leg. There's a smaller one on the lateral side from the knee to the foot called the small saphenous vein. If you go up and look at other things that are different, we have a jugular vein instead of a carotid. There's the carotid artery, jugular vein. We already mentioned the hepatic portal. There's three vessels in the arm that are different. We have a vein that goes medially in the arm, which is called the basalic vein. On the outside of the arm, the cephalic vein. And this vein that's in the center of your elbow, kind of anteriorly, that they normally use to draw blood, is called the median cubital vein. Other than that, most of them have the exact same name as the artery. We just write vein afterwards.